Hi, y'all. I'm Dr. J. Mawhinney. I'm wearing my doctor hat today and not my J. Mawhinney actor hat. I just wanted to talk a little bit about what you should expect to be done for you in an office call. First of all, always remember you're in the driver's seat. If there's financial constraints, have them brought out right in the beginning. And many times things can be spread out for you, but expect the best. I had a practice for 21 years before I started doing relief and then critical care for the last 12 years. My clientele was used to my being able to talk straight to them and honestly and to offer complete workups. I basically practiced the way I was taught at University of Pennsylvania. The exam is very important. Please give a good history. Really try to find out what was going on in your mind with your pet before it came in and before it got sick. I'm talking about the sick animal today. I'm not talking about the wellness exam, which I'll approach at another time. If your dog is mildly ill, you can get away with this Band-Aid treatment that, sadly enough, I found after I left my practice and sold it that many people start with. If there's just a little mild, certainly anytime there's like a kennel cough or something like this and there's no signs of chest congestion, then sure, the palliative treatments with the antibiotics and cough suppressants are fine without a workup. If things continue, then you need a workup. You need blood work and you need x-rays and you need to find out if there's something more serious going on. If you got a vomiting dog or one that's really lethargic and not eating and just laying around, you got a sick dog. And at least a minimum database is important if you can afford it. The whole thing about this is if the old sub-Q fluids and a little bit of antiemetics, things to stop the vomiting, sometimes antibiotics that aren't even indicated, are what's done just to see how he does. Well, if he's pretty alert and happy, that's fine. But honestly, if he's sick, you don't want to postpone this stuff. It's really important. An x-ray and blood work early in the course of a disease can be the difference between having to bail a dog out that's in a life-threatening situation and staying ahead of it and trying to, whether it's a foreign body or pancreatitis or just what we call HGE or hemorrhagic gastroenteritis, you want to make sure that that aggressive treatment and workup is done to rule out things that, if missed, can have a life-threatening dog 3 or 4 days down the road. Most veterinarians are very, very conscientious, but some, as they get on in treatment, and even sometimes only a few years out of school, they've talked themselves into the fact that people don't want a good workup, and they start right out with the little Band-Aid stuff, and sometimes have an animal come back 2 or 3 times before a full workup's done, and that can be a little shaky, and you should insist on more than that. You should ask. You're in the driver's seat. X-rays, urinalysis, blood work is what we call a minimum database, and it just puts the cards on the table and rules some big stuff out and puts some flags up there if there are some changes, whether this dog or cat needs to be hospitalized and aggressively treated, or if it is everything checks out fine, looks like we're okay, then yeah, then outpatient treatment might be okay with bland diet or whatever. But and also your coughing dog, my goodness, if it's a chesty cough or if there's nosebleed or there's anything else that's showing signs of something more severe, it needs to be checked out. It's your love of your life, your little pet, your little dog or cat that gives you so much. You have a responsibility to try to take care of it. They sure love with no boundaries. All they need is to be taken care of. Have a beautiful day.